Let's answer your questions while I am on annual leave in United Arab Emirates. Hi everyone, so I'm on annual leave from my usual training job in the United Kingdom here in the United Arab Emirates, and I thought it would be a good idea to take you through my day and answer your questions at the same time. So to answer your first question, which is any tips on passing FRCOphth Part 1, the one advice I can give you is that don't underestimate the value of questions. Now, obviously, any advice anybody ever gives you is subjective because we all experience things in our own manner and style. What you must remember is that instead of reading a lot of textbooks near the end, make sure to practice a lot of questions. And I have a separate video on FRCOphth Part 1 preparation, so I think you will find that useful. But apart from that, just make sure to spend time on question banks like FRCOphth, Nikki Hall's question bank. Now these are all great ways to make sure you know your knowledge in and out comprehensively before you sit for the exam. And don't underestimate the other subjects apart from anatomy and optics, like physiology, pathology, investigation. So that's my top tip. What you're referring to is the changes that were made for international medical graduates. Now, these changes have not been put in place yet, and all of this legislation is still under review, so nothing is concrete at the moment. So I don't know. We don't know how the IMGs training will be impacted once these come into effect, if they come into effect. As of yet, yes, IMGs can get into training directly as long as you have the requirements like the certificate of readiness to enter specialty training, and you don't have any other issues which can cause problems for you to enter training. You can directly enter into training. So no, you don't necessarily need to do surgery after you've finished ophthalmology training. I know consultants who choose not to operate after doing training, but during training they are learning how to do surgery anyways, and they have to be competent at that surgery. But that's general ophthalmology training. If you choose to do something called medical ophthalmology, which is a smaller branch and smaller training, you won't be doing surgery or expected to be doing surgery from the beginning. That's purely medical ophthalmology. So yes, you do have the options to not operate once you've finished training. It's difficult to know whether a specialty is for you or not unless you actually spend some time in that specialty. Now, I always say ophthalmology is and will remain one of the best specialties in medicine. The reason for that is it has a good mixture of medicine and surgery, and you have a great work-life balance, and the impact you have on patients is great as well, because you're trying to restore vision, you're trying to prevent vision loss. But it's a patient-facing specialty, which means that it comes with all the communication challenges that you would face in any other communication-based specialty. So if you don't like that, you want to do less of a patient-facing specialty, and maybe radiology is for you, or maybe pathology or microbiology is for you. But as long as you're fine having a patient-facing specialty, then I think ophthalmology is one of the best specialties there is. Some people have this queasy feeling with eyes, but if you work with it enough, that goes away as well, just like anything else in medicine. For example, you might have had this problem with blood or any other organs. So yes, absolutely. If I could do things differently, and things I would recommend to other junior doctors, it would be start early. So even though I also started early, I started in the time when I came to UK, and then I started preparing for my portfolio. But anybody I encounter who wants to get into ophthalmology, I tell them you can start even earlier. So if you know the requirements that you need to get into ophthalmology, start in medical university, because I didn't do a lot of clinical research before I got into ophthalmology. But that has points in the portfolio. So if you get an opportunity in medical university, start doing clinical research. You can start doing projects already, some case reports, the Duke Elder exam. There are many things you can do even before you enter into ophthalmology. So there's a famous quote which I also just looked up and found out what exactly it was. It is something that goes, the best time to start was yesterday, and the second best time to start is now. So you're asking about how do you rank. Now I assume you're asking, when you get the training post, they ask you to rank the placements, the locations. It's a good question, and I myself made an Excel sheet, and I was looking at price of property, living expenses, distance from the nearest airport, the quality of the training. There's lots of factors. The next question is whether a master's in ophthalmology will help you get into training. Now, the master's MSc will give you some points in the portfolio, and ultimately a good portfolio will get you into training. Just masters by itself guaranteeing you training is not possible. But yes, it gives you points towards the portfolio. So if you check out my other video where I talk about how to maximize points in the commitment to specialty section of the portfolio there, and in the section where we talk about whether any other degrees can help you, that's where you'll find more information about how the MSc can give you more points in the portfolio. But by itself, it does not help you get into training. So it's a good question. What is it that keeps you motivated and going when everything and everyone seems to be demotivating you and saying that you cannot do something? In my situation, what helped me was keeping in touch with my family, and my family has always been very encouraging and very motivating about things. So calling my parents regularly. The thing was that the specialty I was pursuing was something that I loved. I wanted to pursue ophthalmology. That was the only specialty that I was seeing myself in, surgically and medically. So that's really the two main things I would say which impacted my state of mind during that time when everything seems to be difficult. The next question you're asking me is how to prepare for FRCOphth Part 1. Now I have made a complete video on how to prepare for FRCOphth Part 1. You can go to my channel and you can find it over there. I'll try to put it in the description of this video as well. And I speak about what are the exact resources you need and how much time you need. So you can find the answer to your question there. Alright, so the next question is whether the change in the policies will affect international medical graduates and their chances of getting into training. Now, firstly, most of these things are based on rumors, and the policy that BMA is putting forward hasn't really been confirmed by the government. And so nothing is concrete right now. As of now, IMGs can still get into training posts just like anybody else. But we don't know how things will be in the future. I don't think it's an unfair ask to expect some level of NHS experience before you are placed into training jobs which require more responsibility from you. So let's see how things roll out. But at the moment, nobody knows what's going to happen and exactly what legislation will pass, if it will pass. So you're right that there are a few courses or diplomas which can help you with this. So Teach the Teacher course helps. If you have any introduction to ophthalmic surgery course, that helps. Postgraduate certificate in health education helps. Develop portfolio. All of this is present in the evidence folder guidance for ophthalmology. So if you go to my channel and see the videos on portfolio preparation, you will then find some tips on how and what you need to do to build your portfolio towards ophthalmology, and what are the courses and degrees which can help you with that. Which job is less hectic to build a portfolio for ophthalmology? Any job which gives you enough time in your free time to build portfolio works. I wouldn't say that I was doing a less hectic job. I was still doing a hectic job of stroke on calls and stroke ward jobs. but I managed to find time, and this is because I made time to work on the ophthalmology portfolio myself. But if you're looking for a job which relatively helps you, maybe a research fellow job or a job where you don't have a lot of on-calls, let's say you have the free time after work and on the weekends, all these type of jobs usually help build a portfolio. If you're in the NHS and you can do some locum work, which means you do few days a week and few days you don't, that helps as well. If you get a job in the ophthalmology department, that's even better, because that gives you some opportunity to build connections and do work within the ophthalmology department. So all of these can be good jobs for portfolio development. Jobs which or clinical attachments in UAE helping you with ophthalmology portfolio, I'm not really sure how much that can help, but if they can meet any requirements in the portfolio section, like let's say doing electives or doing taster weeks or spending free time in casualty and theatre, then yes, those can help. But how they can exactly help, not too sure. Now, I did my medical education from UAE, so I've done attachments in ophthalmology in UAE as well, and it counted as an elective because I did it in my internship year, or FY1 year. So if you can do something like that, maybe it will help. But there's no clear guidance on this matter. And it's time for suhoor right now. It's Ramadan, and so as part of fasting, we'll be eating a little bit food just before dawn. And once we do that, we will start fasting. So that is it for today. I will see you in the next video, and hopefully be able to answer some more of your questions next time. Bye bye.